Dear students, choosing a thesis topic is what you must be going through at this point in time, because for all those who have joined afresh as first year postgraduate students, that is one of the requirements, that you need to write a protocol in the coming 1 month or so. And this protocol has to be ratified initially by the departmental research committee, meaning thereby constituted in the Department of Orthopedics. And then finally, it is ratified by the institutional ratifying committee, including the ethics committee. Well, uh, thesis is something which is a prerequisite to pass the MS Orthopedics and the DNB Orthopedics examination. So this is something which you cannot avoid. And to my mind, there should be no reason to shy away or to be afraid of writing a thesis during the course of your post-graduation, which is the thesis writing exercise is usually 2 years, the initial 2 years. And in some institutions, it may extend to 2.5 years, because as far as the Delhi University is concerned, uh, I am very sure that the thesis needs to be submitted 1 year prior to your MS Orthopedics examination. But in some institutions and universities, the time period is reduced to 6 months. So you get additional 6 months to process or write your thesis. As I said, that thesis writing should be taken seriously for the simple reason that it has a career building ability. What I mean by this is very important, because what you choose as a thesis topic today, and if you do it carefully, then it has the potential that you may continue to work on this topic even after submitting your thesis. You may continue with the follow-up of the cases. You may continue to have a long follow-up and then come out with a presentation or a publication which will have much more weightage than just having a 1 year follow-up. It also has the ability for continuity. You can continue your thesis project even after submitting it as a postdoctoral project, because some of you may like to go in for a postdoctoral program like a PhD program, where again you may need to do some sort of a project or a thesis. Well, you must remember that whatever project you take up as a thesis, you should be able to improve your curriculum vitae, and that can be easily done by preparing oral presentations out of that thesis topic. And also, you must publish whatever inference you draw. So publications in reputed journals is only possible if you take your thesis work seriously and you choose the topic carefully. If you do a good thesis, work on it diligently, honestly, then this has the ability to provide you recognition in the field of orthopedics when you are working as a senior resident or later in life as a practicing orthopedic surgeon or as a faculty member in one of the teaching institutions. Well, students, thesis can be a painful or an enjoyable journey, and it depends on the appropriate choice of the thesis. So the methodology involved in choosing the thesis should be carefully studied, pursued, and this is the right time to do it because you are in the process of choosing a thesis and writing a protocol for it. Well, friends, how to choose a thesis, you must have realized, is important. It's not just a casual exercise. And you choose your thesis also with the ability or the interest of your guide in mind. So all these points or the nitty-gritties and the finer points on how to choose a thesis, I would be talking about next Thursday, that is 21st of July 2022. The timing would be between 5 p.m. And all of you are welcome to join in. Thank you very much.